VCS is probably one of the largest private groups in the state of Virginia, and we also have been the first for a lot of different cardiovascular initiatives over the years.
First practice to have a dedicated cardiac CT, PET CT. We also recently opened ASC, first cardiac dedicated ASC in the state. So we've always been a driven practice trying to look for what else can we do to better serve our patients.
We started our chronic care management program probably well over 6 years ago. So we were an early adopter because we really felt this was going to be a good service for our patients. Our chronic care management just really focused on heart failure patients and some AFib early on.
We decided to implement a CCM RPM strategy after initially starting with CCM and realizing the value in extended care of our patients beyond just what we had in the office or even virtual visits. And RPM was a natural extension of that philosophy.
We had been using another vendor for chronic care management, and they were starting to offer some RPMs, but we really felt like we needed somebody that had a more robust monitoring program, as well as outcomes and reports that we could use to integrate into our care of the patients.
We're looking for a partner who would help throughout the whole cycle of RPM and CCM. So bringing the patient in, sending them the monitors, teaching them how to use the monitors, then getting the information into our EHR and billing for it. We looked for somebody who could really meet those challenges.
And HealthSnap won out over about 4 or 5 other vendors.
HealthSnap has been a fantastic partner, truly outstanding commitment to customer service, not just for our practice, but honestly, more importantly, for the patients. And the feedback we have received from them has been tremendously positive. And a key factor to that is the stability of HealthSnap's nurse navigators, who the patients truly see as an extension of our practice and not just a random third-party vendor.
It's really great to work together with our HealthSnap patients and our CCM and RPM monitoring. And so we work together to take care of our patients and bridge the gap between home care and clinic care. And it really makes a big difference for our patients.
They have taken a lot of initiative to make sure our patients are fully oriented and communicated to what the program's all about.
There was a patient who experienced AFib, and she didn't always know when she was symptomatic. So her care navigator picked up on that during the conversation, asked her some simple assessment questions. She shared that back with VCS, and they were able to get that patient scheduled for the testing that she needed, get her pulled into appointments that were necessary, and get her taken care of. And otherwise, she may have just let that go.
By having HealthSnap be able to provide those resources and having us be able to tap into it had a tremendous impact in a positive manner on our practice.
Some of the clinical and quality benefits that I've seen related to blood pressure is that we get control more quickly and more efficiently. Having the patients be able to monitor at home each day, we're able to deal with blood pressure changes and medication changes more quickly.
And that would obviously lead to fewer ER admissions, fewer urgent care admissions, better patient outcomes, lower cost to patient, and health systems in general. I would absolutely recommend HealthSnap for any practice.